question. Hopefully I've got an answer for you. And go ahead and start typing those questions. And now we'll do our best in the next hour to get them answered for you. If you're new to the show, the name of the game is you ask your nutritional question, I give you a great answer, and everybody wins. You get the knowledge to help your body heal and repair itself. And let's dive in. So we got mom, 83, never smoked, drank, diagnosed a few months back with a neuroendocrine tumor. After pain took her to the ER, it's inoperable and need alternatives to chemo. If I were you, I would look into Dr. Makis, M-A-K-I-S. He's doing a lot of really fantastic work in the realm of cancer. I don't want this whole video to get banned by saying these things, but he's using some classic meds similar to what were being used during the pandemic. And they're seeing tremendous anecdote stories of people's tumors shrinking dramatically. So look up M-A-K-I-S. He's on X. If you go there, you can check him out, and he does consults. But that's what I would do with an inoperable tumor, is check him out. The other place you could check out is Hope for Cancer. They're an outfit, Dr. Tony Jimenez down in Mexico, and they also do really great work with cancer patients. So look at both those. And Tony Jimenez, Dr. Jimenez is an oncologist. So let's see here. I have chills and my fingers become very crampy. When this happens, the nail appears purple in color. Additionally, my ankle becomes swollen like 15 minutes after getting home from work. What's the question in that? So if you're looking for some kind of a solution, there's a lot of potential areas that, or things that could be contributing to that. I mean, the cramping, well, the chills could be a lot of things. The cramping, oftentimes it's electrolyte, hydration. So easy, low-hanging fruit. Look at electrolytes, calcium and magnesium and potassium. As far as the discoloration, if they're turning purple, you've got a circulation issue, and that could also cause cramping. But circulation is a very important and comprehensive topic. It includes the strength of the heart, the ability of your blood vessels to contract and relax, the hemodynamics, if you will, of the blood flow, whether or not you're aggressively plating. So there's a lot of things that naturally can be done for blood flow, one being just omega-3 fatty acids. They actually reduce thromboxane and reduce platelet aggregation. Magnesium can reduce and help can improve blood viscosity. So maybe ask a more specific question and I can get you a more specific direction. Christina's asking, I'd like to buy your products, but I see the supplements cannot be delivered to Europe. Is there any possibility of purchasing through other channels? We're working on it. So be patient with us, Christina. We are working on it. Genetic testing is also not available for people from other continents. Actually, call customer service. A lot of times we can drop ship DNA testing internationally, Christina, depending on where you live. But reach out to our customer service department, glutenology@gmail.com. And inquire, and they may be able to get HLA-DQ testing drop shipped to you directly. Supplements we're working on, HLA-DQ we can do depending on where you live. We need guidance. Okay, I think I answered that one. How do vitamin C and quercetin work together synergistically? Predominantly, they work in the cell membrane by inhibiting arachidonic acid and cyclooxygenase. So if you go and look those things up, you can see the mechanistic pathways. But they do that together. And when you take one or the other, they do it singularly. But when you take them together, the effects are even greater. I'm desperate need lower my heart rate. So Bella says, I am in desperate need of info to lower my heart rate. Depends on why it's elevated. A lot of people have elevated heart rates because of sympathetic dominance, which is the part of your autonomic nervous system that is the fight or flight pathway. So if your heart rate's elevated for no reason, if you're sitting there and your heart rate's going up, you could have a dysautonomia, meaning your parasympathetic nervous system's not turning on and your sympathetic nervous system is on all the time. So there are a lot of strategies around that. One would be meditation or prayer. Another would be, if you've never heard of a float tank or sensory deprivation therapy, that sometimes is a game changer for people in terms of dysautonomia. So worth looking into. A lot of places in the cities, there are a lot of, it's like a massage. You can call them up. It's not a massage, but it's like that. You can call them up and schedule a session, and float tank sessions are generally like an hour long and can work really well to activate the parasympathetic nervous system. Beyond that, nutritionally speaking, there are a number of things too that can help. Vitamin B1, dysautonomia, oftentimes elevations in heart rate are triggered by B1 deficiency, CoQ10 deficiency. Magnesium would be something else I would be looking at or looking into, but those are places to start. Outside of that, look to diet change. Always look to diet change. So the precursor answer to all of your questions is, whatever your problem is, diet change is number one first. Always look to diet and lifestyle change. So diet would be Follow No Grain, No Pain. If you haven't read my book, go get it. Amazon carries it. You can buy it at major book retailers across the U.S. And even in Europe, they have versions of it. So read that first and apply it. Secondarily, make sure that you are doing your other fundamentals, going to bed on time, exercising to tolerance, getting adequate sunshine exposure, drinking clean air, breathing. I'm sorry, you don't drink air, drinking clean water, breathing clean air. Those are fundamental. You can't bypass fundamentals to get healthy. So if you're doing those fundamental things first, now when you have a problem, now we dive into the strategies, to the unique kind of biochemical blueprint type strategies. And those of you who are struggling and you've been in the DIY mode for a while, like watching podcasts, watching shows like mine and others, call my office. We'll put that information up. If you are struggling and you haven't found a solution, you don't have to do it alone. Call my office. We do consults, nutritional consults, and I have an associate doc here with me as well that can see you. So don't hesitate to reach out. We do have a clinic that we help people with as well. I've cut out all gluten and dairy products, even the gluten-free. I've now cut sugar out too, but my bones and joints cripple me with pain in the mornings. I also suffer with blocked eustachian tubes. If you're still hurting, how long have you cut all those things out, Kimberly? First of all, that'd be the first question. If it's less than 6 months, stay the course, because for example, gluten antibodies take several months just to get out of the system. So the inflammation subsidence can take time. But get INA tested. If you haven't done that, this is micronutrient testing. So getting your intracellular nutrition analysis done will sometimes provide insight into different nutritional deficiencies that might be contributing to your pain. We'll put a link up for that INA testing, because you can do that online. And outside of that, if you've got blocked eustachian tubes frequently, that you might have some air quality issues within your home. You might have some allergy issues within your current environment. Mold can be a contributing factor to that. So mold can also cause chronic pain that's crippling in the morning. So all those are possibilities. From a supplemental perspective, have you tried SPMs? That chronic morning pain, that autoimmune type pain, sometimes SPMs kind of kickstart the healing process when the diet change in and of itself hasn't been super effective. So that's something else I would look at, is SPM. And go watch my SPM crash course if you haven't. Can curcumin and ginger help relieve muscle and joint pain? Yeah, both curcumin and ginger both have compounds in them that are anti-inflammatory and have pain-reducing effects. So it's worth a try. I mean, I always gravitate toward try natural first, because most of your pain options in the pharmaceutical realm, whether it's a non-steroidal anti-inflammatory like aspirin or ibuprofen or Motrin, that class of medication, blocks vitamin C. Vitamin C deficiency causes chronic pain. You don't want to try to treat pain with something that can potentiate pain in another way. Those medicines also block folate, which is necessary if you have joint pain. You can't make and renew cartilage without folate. And they also block iron, and iron deficiency can also cause pain through the lack of oxygen mechanism. So you've got a class of medicines that can contribute to, poor nutritional outcomes, which also lead to pain. So natural is always the best place to start. I know there are some of you out there that maybe need medical intervention because it's that intense and your quality of life is that poor. But the other thing I would encourage any of you to do around pain is and the research on this is really quite clear. People that have intense pain that require like opiate medications or heavy hitters, what they have found in literature, and I found this to be true in practice, is that if you combine those opiates with vitamin C, then the patient needs less opiates. And so vitamin C has its own analgesic properties and anti-inflammatory properties that synergize with medicine to make you need less medicine. So if you're, finding yourself on oxycodone, OxyContin, any of those types of medications, couple that with 3 to 5 and even upwards of 15 to 20, there's a range of vitamin C, and see what happens with your need for pain medication. But that's been researched in humans, and we've been using that mechanism for years, and people coming to the clinic. I have pain in the lower thoracic peripheral. What does that mean? Lower thoracic peripheral. Be more specific, Jerry, because I don't. Lower thoracic peripheral. I mean, the thoracic spine is in the center. From T1 down to T12, and so yes, you can have a nerve impingement or neuropathic problems in that area that can radiate peripherally to the hands. So I don't know if that's what you mean. The dead navicular, if you're talking about the bone, the navicular bone, I don't know who told you it was dead. Did you get a steroid injection and it destroyed the bone? Were you diagnosed with osteonecrosis? Try to be more specific, because I want to answer your question, but I don't have enough data to give you a solid answer. What helps with gout? Dave's wanting to know. Gout's really simple. One of the best things naturally you can do for gout, Dave, is cherry. Eat cherries. Cherry juice would be a real simple thing without the sugar. Don't get an organic cherry juice without the sugar. You can also eat organic cherries. You can also take higher doses of vitamin C. It can be very, very beneficial for folks that have gout. So, anywhere from 4 to 5 grams a day is a good place to maybe think about starting with vitamin C to support you. Squamous cell carcinoma, naturally. You're talking about a skin cell. What can you take? You can take antioxidants because they're all going to be supportive of that. But there's nothing really orally that you can take that's going to make that go away. So part of it, Christine, also depends on, are you being treated by a dermatologist? Are you having that removed? Are you having it frozen? Are you having, what kind of treatment options have been presented to you? Because of where you probably want to go is vitamin D first. A lot of people that develop skin cancers actually have a vitamin D deficiency because they're avoiding the sun, and sun avoidance can contribute to skin cancer. So, I know that's not what the dermatologists are telling you, but that's the reality. The research pans out and plays that out time and again. But maybe be more specific, because there's nothing that you're going to naturally take that's going to rid you of a squamous cell. Are there circumstances where your body uses extra magnesium? All kinds. The number one circumstance of increased need for magnesium is stress, right? And there's physical stress, there's chemical stress, there's what we differentiate as emotional stress. So like somebody having a job they hate or a spouse relationship problem, all of those types of stress are going to deplete magnesium. You're going to need more magnesium to cope and adapt to that stress. Eating high carbohydrate diets from processed foods particularly will deplete magnesium. So if you're eating packaged foods, that are higher in carbs. That empty calorie carbohydrate is going to cause your body to deplete its magnesium stores in order to process the carbohydrate and convert it into energy. That requires magnesium. So those are probably two of the simplest things. Outside of that, there are a number of different other parameters and factors. Increases in exercise, increased sweating can drive up the need for more magnesium. Certain medications that deplete magnesium, what comes to mind particularly is birth control pills or estrogen-related medications deplete magnesium at a faster rate. So women, if you're on estrogen replacement therapies or birth control pills, consider using magnesium to offset that. Additionally, alcohol can deplete magnesium. So if you like your drinking, you want to consider magnesium. What would cause muscle weakness and pain mainly upon waking? So you wake up with pain and weakness. You might have a rheumatological condition that's affecting like polymyalgia, so in that regard, Kevin, there's 4 kind of common themes behind non-injurious pain or chemically induced autoimmune inflammation pain. Number 1 would be the diet. The wrong food can cause chemical inflammation that leads to that. So measuring nutrition, measuring food reactivity, food sensitivities, food allergies becomes an important piece of that equation. The second is chemical exposures, perfumes, lotions, soap, shampoos, fabrics, dyes. What do you wash your sheets in? What do you wash your pillowcase in? Because you're getting in bed and waking up in pain. Like, are there any things that you're being exposed to as you get in bed and go to sleep that your body isn't liking, and that's manifesting as inflammation that hits you in the morning? Number 3 would be nutritional deficiencies, not having adequate nutrients to regulate pain and inflammation. It's very, very common. And if you watch Tuesday's show, I go into some of the depths of the more common nutritional deficiencies or nutrients that would help with that. And then in addition, microbes. What we see oftentimes triggering kind of morning stiffness, morning pain are gram-negative bacteria overgrowths like Klebsiella, Pseudomonas can produce toxins that kind of emulate your joints and emulate your muscles. And so it can lead to what's called molecular mimicry, an attack against your own tissues. And that can certainly contribute to that morning pain as well. So I would investigate all 4 of those areas. And the way you would investigate those areas mainly is work with the functional practitioner. Again, you could call our office, or if you want to work with somebody that you already have a relationship with, but that should be the avenue of investigation. What do you think about medical grade hydrogen peroxide? I think it has a lot of uses, but as far as what do I think about it, there's a lot to think about something. Maybe be more specific about why you would want to use it or what kind of context you'd want to use it in. What products in what wheat products and skin care products? One says gluten-free but has colloidal oatmeal, and one is a magnesium butter which has wheat germ oil. I'd throw them both in the garbage if you're gluten sensitive. I don't agree with a lot of the others that claim that gluten can't pass through the skin. So especially if you have a pre-existing skin condition or a cut or a scrape on your skin, and now you're going to apply that directly to that cut or scrape. Now it has access to your bloodstream, and now you're having a reaction. So, I would say in your skincare products, it's best to avoid the presence of any type of grain-based ingredients if you're gluten sensitive. Please share the list of supplements you take and their frequency. I did that, I think, a few weeks ago, but I mean, as a general rule, it depends because I will mix mine up, but I will always take an omega-3. So that's Ultra Omega is the one I prefer. So Ultra Omega, I take 2 a day of that. Ultra Nutrients, which is my multivitamin, I take 4 of those a day without fail. So those 2 things every single day without fail. When I'm training, I like to use creatine monohydrate, which is a substance that can help with energy and recovery and just your overall workout. So I really enjoy using that product for my exercise routine. And then beyond that, it just depends on what I'm trying to do, what I'm trying to accomplish. Sometimes I experiment with things. Sometimes when I run my own testing, because I always, when you ask me, what do I take on a regular basis? I take tests. I take blood tests that help me understand what my body lacks, so that then I can target very specifically which nutrients to add potentially supplementally to. So the test that I recommend is called an INA. It's available on Gluten Free Society. We can put a link up for you, but start there first. A lot of you are spending hundreds, if not thousands of dollars, a month on supplements. And if you're just guessing at it, you could be taking some great things. You could be taking the right things, but you could also be spending money on some of the things your body doesn't really need and aren't going to benefit you. So if you're really trying to target what your body needs, highly recommend testing over guessing. For those, Jessica's asking, for those with lower back, scoliosis, and hip pain, how do you recommend exercising to help build glutes and upper leg muscles without hurting the back or hips? Slowly, scaling the exercise routine, Jessica. So, if you're trying to build your glutes, deadlifts would be a bad move if you're struggling with hip and back pain. But first I would, if I'm helping somebody with scoliosis, I'm going to do a physical examination. I'm going to diagnose the potential, like what level of scoliosis is it? How bad is it? Is it a congenital scoliosis of 30 plus degrees, or is it kind of a more mild scoliosis that is muscular imbalance from chronic sedentary behavior or something else, right? Are there muscular imbalances or joint imbalances within the hip or low back that are contributing to misfiring or miscue and causing those glutes to shrink and those other muscles to become weaker and creating that pattern? So what has to happen in that regard is an assessment by a doctor that knows what they're doing, and very good orthopedic assessment. And then from there, customizing exercise patterns into something that will work for you. But generally, as a general rule, if you don't have that assessment, then you can try different things. I mean, I always encourage people to explore their bodies in the sense that try different stretches, try things very lightly, very mildly, see how your body reacts and responds. Does it cause you pain? Does it cause you discomfort? Discomforts and pain are two different things, right? When we say if you're doing an exercise and it's like a sharp stabbing or shooting pain, that's the wrong exercise. If you're doing a stretch and it's like a sharp stabbing pain, don't do it. That's your body's message of saying that's an acute pain that you're causing by that behavior. Stop doing it. But if it's just a discomfort because some of you are very tight and some of you are very stiff, and so when you're starting to engage your body with activity, sometimes it's just a little uncomfortable and you have to kind of work through some of that, but work through it slowly versus quickly, because you also don't want to injure yourself. Okay, let's scroll down on the left. I've seen good studies on the benefits of glucosamine. Could you please share about studies for chondroitin and MSM? I can, but I'm not going to dive into studies in the Q&A aspect. That's more for a crash course. We may have to come back and entertain that. Can adding dead sea salt to bath water and soaking 15 minutes make vitiligo worse? It wouldn't be in the top of the list of my suspicions. The hot water might make it worse if you have like a POTS-induced vitiligo, and that increased heat sometimes can create or exacerbate lightheadedness and increase. Actually, you didn't say, you said vitiligo, you didn't say vertigo. Sorry, I misread that. Yeah, I wouldn't suspect that soaking in salts from the Dead Sea would enhance the depigmentation of your skin. That wouldn't be my first line of thought at all. I'm curious about the impact of supplements on kidney function. I think taking large amounts of supplements is not so innocent when we think about the kidneys and liver. Can we open the capsule and take the contents so that when we shake it into a glass of water and drink it, it seems unnecessary to eat the wrapper? You can, Christina. And I think a lot of people, depending on how many supplements you're taking, breaking the capsule open, provided the capsule's not like a sustained release capsule or a capsule that's designed to bypass the stomach and get that ingredient down into the lower intestine for absorption, then yes, you can certainly, for many products, provide, again, there's context there, but for the most part, yes. But I would disagree. I would say, depending on the supplement, there certainly are certain things that people can take that might impact kidney function or liver function, but the vast majority of vitamins and minerals aren't. They're not going to damage your kidneys. They're not going to damage your liver. I mean, there are exceptions to every rule. There are people that have their own unique experiences, but as a whole, look up poison control and look up side effects or reports of people being hospitalized or having kidney damage or liver damage over supplements. It doesn't really exist. I mean, there's barely any case reports of any of it. And if it were more of a prevalent problem, we'd have more reports. Now, some would argue, well, where do you report that to? You would report it predominantly to your doctor, and sometimes ER doctors and sometimes GPs will make these reports, but they're very, very rare and few and far in between. To the contrary, medication is the third leading cause of death in the United States. I would say we have a much bigger problem in that regard than we do with supplements. And so that's not to say a person can't have a side effect, because that certainly does happen, and I'm not going to dismiss that as a commentary, but I just don't want anybody to have an unnecessary fear over kidney or liver dysfunction as a result of taking supplements. Now, if you're taking a boatload of supplements and herbals, and certain herbals can impact the kidneys or can impact the liver, that's a little bit different. But when we're talking about vitamins and minerals, generally very, very safe. Let's see. What do you think of, somebody's asking about the patches, the little patches that are stem cell patches. And, if you want to spend your money on something like that, you can. I'm not opposed to it. I don't think it's necessary. I haven't seen it create any miracles in anyone. And I've had a lot of people come to me who use those that are still struggling, and that's why they're coming to me. So maybe my opinion on it's a little biased. Maybe the people that are out there that are being helped by them aren't coming to me, and so I don't see those cases. But as a general rule of thumb, passive therapies are not, I don't put them in the high level of priority. What I mean by a passive therapy is when you apply something to the body that does the work, that's passive, right? So an example of that might also be laser therapy, ultrasound therapy. Some people use massage therapy. Again, massage is great if you need some general relief. I'm not trying to rock massage, but it's a passive therapy. It's a short-term benefit. If the person doesn't take their health into their own consideration, if they're not applying, the tenets of good health to themselves, then any passive therapy, you're just going to develop a dependency on needing the passive therapy without addressing the core reason as to why you're using the passive therapy in the first place. So hopefully that's helpful. I have severe sinusitis. What supplements can I take for something like that? So I would look at NAC and acetylcysteine, along with bromelain and quercetin and vitamin C in combination. Simon, we have a product called Ultra Sinus Support you might want to check out. But ultimately, too, if you've got a sinusitis, you might have an infection, so you need to get that checked out. You might also try using a neti pot to kind of rinse out your sinuses as well. I have gluteal tendinopathy and hip bursitis. I've had steroid shots and physical therapy, many sessions, multiple times in the last few years. I take Mobic. Can this pain ever go away? Yeah, you've got to figure it out, because, the PT was wrong if it didn't help. Not to say that that it wasn't helpful, but it didn't lead to resolution. So obviously it wasn't the right PT, or it wasn't the right length or timing of PT. Steroid shots don't ever resolve anything. Steroid shots, they come with their own set of risks and problems, but they're going to last 3 to 6 months. If you don't fix the origin of why the tendinopathy exists, the pain's going to come back. So tendons generally are very low blood supply, and one of the reasons they can be hard to treat is because the richness of oxygen and nutrients are not always hitting the tendon as well as they do the muscle. So the vascular supply to the area can be reduced. And this is an area where some physical therapy passive modalities or some chiropractic passive modalities might be helpful in your kind of journey. So laser therapy, cold level laser therapies might be helpful. Ultrasonic technology might also be helpful in that regard. You might also look into BP157 as an adjuvant therapy, an injection of it, not taking it as an oral supplement, but the actual injection into the area. You might also look at stem cells. Those are all things that are passive that might get you over the hump so that you can start and maintain the activities and the exercises that are necessary to fix that problem. But you need to get the diagnosis of why that tendinopathy started in the first place. And that there are a lot of reasons why that could be the case. Find a good chiropractor. That's probably one of the best pathways to a physical diagnosis to try to determine why that pain started in the first place. Can I add a probiotic capsule in the bowl of milk with a starter yogurt? I don't see why you couldn't. I would say that if you're reactive to milk, a lot of people are. If you're struggling with a lot of problems, you might relook at milk, read some of our shows and articles around milk, because that's one of the top 5 foods I see cause people's problems is dairy. I already did the diet change. Vegan advice was on target. Okay, good deal, Bella. Is MSM better than boron? It's not better and it's not worse. It's dependent upon the individual and their problem. Is boron deficiency a thing for that person? Then I would say then boron would be the better choice. But if they don't have a boron deficiency, then I'm not necessarily going to use boron as a treatment for osteoarthritis if boron deficiency isn't the person's problem. So it just depends on the scope of what's going on with the person. Let's scroll down a little bit. I get back pain every 3 months, knee pain. I'm 55. No question there, more of a commentary. Would you kindly remind me where it is again you place wild rice? Does that mimic gluten proteins as well? No, wild rice is okay, Dawn. So we put it on the gluten-free list. It's safe. It's a safe food. But keep in mind that many people are allergic to grass. Wild rice is a grass. And so even though it doesn't have gluten in it, a lot of people will still react to it. So I would just say eat it, knowing it's gluten-free, but eat it with kind of caution and attention to how you feel when you do eat it. And that way you don't, if you are reacting to it, even in a milder manner, you can pick that up. I side sleep and wake up all night with my legs aching. My hips look bluish. Could it be blood clots? Could be your mattress. If you side sleep, you might consider a body pillow between your knees. Sometimes when people sleep on their side, depending on their body, on their shape and their structure, you can put increased pressure in the back or in the hip area, and that can create some issues with aching legs. You could have clots. I mean, generally though, clots manifest as a different type of pain. And what you're describing, it wouldn't be my first line of thought. But if you can rule that out, you can go see a doc and get a Doppler done to determine whether or not you have any clots. And that might not be a bad idea, just to play it on the safe side. How many SPMs should I take in a day? Suffer chronic pain from malformation. I'd start with 4 for the first 2 to 3 weeks, and then take that down. Once you get a good load in, take that down to 2 to 3 capsules. And I would do that for at least another month and a half. It takes about 2 months for a lot of people to reap the kind of the benefit that SPMs can provide. Now, some people find that it's almost instantaneous, but most of the time it's like, 4 to 8 weeks for SPMs to really kick in. What can I use for the swollen ankles and toes? Depends on why they're swollen. If you've got a heart problem, you could have a heart problem that's causing swollen ankles and toes. You could have a chronic sedentary problem. So be more specific around the symptom. Is bone broth a good collagen source? Depends on the bone broth. Some of them are, and some of them aren't. If it's cooked down really, really well and contains a lot of the rich collagen within the broth, yes. If it's not, if it's more of a kind of a soupy broth versus a thick broth, then it's going to have a lot less collagen as a source. When taking cod liver oil, how do I add them together? Are there concerns about too much of a good thing? Not really. I mean, if you're taking cod liver oil, you can take SPMs as well. Cod liver oil, I'd be cautious around cod liver oil daily because of the quantity of vitamin A, and I've seen cod liver oil create a burden on vitamin D because the A in cod liver oil is so high. So it's just not my preference for what people should use for their omega-3 supplementation. I don't know if that's why you're taking it, but if you're taking it as an alternative to an omega-3 supplement, I prefer gelatinized capsules with a controlled EPA DHA dose for omega-3 over a cod liver oil all day long. The biggest issue, SPMs don't generally trend toward creating a thinness in the blood that could lead to, like, sometimes when you get fish oil doses up above 4 grams a day, 4 capsules a day, some people will have nosebleeds, or they'll have the blood will thin out to the level that they'll have easy bruising. And so beware of that. But that's not real typical of cod liver oil, and it's definitely not typical of SPM. Difference between alpha-linolenic acid and alpha-lipoic acid. Alpha-linolenic acid is a type of omega-3, technically omega-3 precursor, whereas alpha-lipoic acid is a nutrient substance that has potent antioxidant and liver regenerative effects. So they're just not, they sound similar, but they're not close, even in the same ballpark of the same thing. What type of test did you use to determine the food allergies for the young girl who had a blueberry allergy? In her case, it was a IgE, and it was a delayed hypersensitivity response, Gay. So you can be allergic to a food, you can be sensitive to a food. They're not quite the same thing. A sensitivity is a different mechanism of the immune system. An allergy is an IgE-related mechanism. And in her case, Ginger's case, if you're referring to the girl I wrote about, No Grain, No Pain, she had both. What do you suggest for a lung-deafening, not expanding? He said getting extended. There's so many typos in that, Luther. Maybe look at your question and maybe retype it, because I can't understand what you're asking. How to increase progesterone and reduce prolactin and cortisol? Get off of grain. And if you've got hyperprolactinemia, gluten is a major contributing factor in that. I've seen that happen more than 100 times over the last 20-odd years in practice. Gluten is an endocrine disruptor, and it can cause a disruption. It can cause hyperprolactinemia. It can also reduce your progesterone, and it can also increase your cortisol. So I don't know if you're, Suman, if you're on a gluten grain-free diet, but strongly would suggest that you read my book and check it out. Can tallow cause allergy? Tallow doesn't cause allergy. Could you be allergic to tallow? I don't know if that's what you meant in your question or not, but yes, you could be allergic to tallow, but it's not common. But tallow in and of itself is not going to cause you to have an allergy. Let's scroll down in the middle. How much magnesium can you take in a day? If you're doing it at home all alone without help, and your kidneys and are healthy and you're relatively healthy, you can take 600 to 1,000 milligrams of magnesium a day and probably stay out of trouble. But if you're going to do that for any longer, lengthy period of time, I would get your levels tested. If a friend is going to a regular doctor because of a headache, what kind of prescription is that person likely to receive? Depends on the kind of headache, Diana. There's cluster headaches, there's migraine headaches, there's tension headaches. So it depends on the diagnosis that your friend gets. Unfortunately, one of the areas that we have seen, this is actually a pretty good paper published, this was probably 10 years ago, on diagnosing musculoskeletal conditions in GPs. So like patients would go to general practitioners and they were analyzing the ability of general practitioners to give an accurate musculoskeletal diagnosis as it related to a number of different conditions, but headaches was one of them. And what they found is that more than 50% of the time, GPs were misdiagnosing the actual reason as to the headache. So it largely is going to depend on the GP and their knowledge base around headaches and how to go about a physical examination and laboratory to properly diagnose that headache. But a lot of times that it's pain medication. And so there are a number of, if it's a migraine, there are different types of classes of medications that are commonly referred to for migraines. And then there are muscle relaxers and non-steroidal anti-inflammatories that are commonly prescribed for other types of headaches. So it just depends. To me, if I was having a headache and I weren't me and I didn't know what I knew, but I was choosing the kind of the type of doctor I was going to go see, I'd go see a chiropractor. Hands down, best at diagnosing headaches and types of headaches, in my opinion, in the world. What type of test do you use to determine? Okay, I think I answered that one. Gluten-free and the traveling joint pain and inflammation from head to toe has stopped. Could pain in the hip be caused by known osteoporosis? I mean, not probable. Osteoporosis is typically not painful unless it's so advanced that you're having microfracturing, of the bone, which is not real typical or likely. But hip pain, I mean, there's a lot of different reasons a person can develop hip pain, and I'd go get it if you haven't figured that out. A lot of times it's tight intrinsic muscles, internal rotator muscles in the hip. Sometimes it's chronic sitting or chronic sedentary behavior causing atrophy of the gluteal muscles and the piriformis muscle, shifting the hip out of alignment. So I'd start with a good physical examination and get with the doctor who can do that to give you a solid diagnosis. But it's most likely not osteoporosis. That's not to say it couldn't be, just not common and not likely, especially if exercise has helped. What's a good alternative for CBD for someone who gets random drug testing? Why are you taking CBD? So you shouldn't need CBD. I mean, some people take it for pain or for nerves or whatever, but tell me what you're taking it for, and I can give you kind of a better answer around a good alternative. Any advice for osteoarthritis pain? Probably one of the easiest things is movement and motion. Osteoarthritis pain responds extremely well to movement, to activity. And if it's a lot of pain, start with easier activity, light stretching, kind of break that joint in slowly. That the vast majority of osteoarthritis is caused by inactivity, meaning the cartilage and the surface of the joint erodes as a result of lack of use. It's very rarely is osteoarthritis in elderly people caused by excessive or redundant use. I mean, unless you've got somebody who's got an extremely physical job, but that just in today's day and age, it just doesn't really exist all that much. Not to say it couldn't be, but most people's osteoarthritis is lack of movement. So starting with movement, I would stretch the joint, I would mobilize the joint, and then I would start working on strengthening the muscles around the joint. Because for most people, osteoarthritis will go away with that alone. Now, beyond that, one of the low-hanging fruit to get kind of some immediate relief, glucosamine, chondroitin, and MSM. We have a product called Ultra Joint, for that. And I would recommend, Angela, that if you just want something right now to take, that would be it. But that long game strategy needs to be motion. Is homeopathy good? Can be. I mean, homeopathy works. It definitely works. I mean, there's some great research on the benefits of homeopathy, and we sometimes use homeopathics in our practice. But it just depends. I mean, it's like with any other medicine. Medicine in and of itself is a passive therapy, and you've got to get to the reason. And most of the reason that people are ill or struggling is because they're making choices that lead to the manifestation of symptoms. And those choices are diet and lifestyle typically. So change your choices and you can change the outcome. And during that process of changing your choices, homeopathy and nutritional supplementation and other things can be good options for kind of helping push you through that. But at the end of the day, you've got to make different choices. That's what No Grain, No Pain is principled around, is change your diet, change your behavior, change your life. If somebody's sensitive to frankincense incense, would they also be allergic to boswellia? It's possible, but there could be other things in the incense beyond the oil itself that the person could be reactive to. Kyle said, I like this comment by Kyle. Thanks for chiming in with your experience, Kyle. I just want to say, for anyone out there struggling post-changing your diet, it took me about 19 months to feel normal again. Keep pushing. It takes a while to repair systemic inflammation. God bless. Thanks for that. And he's not wrong. In my practice, as we're walking people through this and doing testing and being very specific, on average, it takes with somebody with a chronic inflammatory issue, can take about 18 months to kind of get them to where they want to be, and sometimes longer depending on life variables and other factors that could pop up. But I'm not talking about taking a year and a half to see improvement. I'm talking about it taking 18 months to hit your goal. So you have to be patient with it. This is, most of you who are struggling because you've been struggling for years. In many of the cases, the people that come to me, decades. And we're not going to reverse decades of inflammation in a week or 2 weeks with diet change. It's not a reasonable thing to expect that. It's kind of like going to the gym. You don't go to the gym and work out twice this week and you're buff and ripped. It's consistent behavior amplified over time that leads to an outcome that's beneficial. And it's no different with diet change. Will oats test be accurate, or does the result change hour to hour? Oats is, I'm not a fan. I mean, it's going to change rapidly because of the methodology of the testing. And so it's not something that I would use for kind of long-term decision making for that reason. So it's I know a lot of doctors want to use that particular type of testing technology. I'm just, it's not to say it can't be beneficial. I do order it from time to time for specific reasons, but it's definitely not in the main wheelhouse of tools that I would say are absolutely necessary to help assess somebody. Can you give any suggestions for Lyme nerve leg pain? It's been there for years, about 6 months, or about 6, morning, noon, and night. Nothing has taken it away, and the pain is excruciating. I'm sorry to hear that. Have you tried alpha-lipoic acid at high doses along with vitamin B1 and CoQ10? So that combination would be kind of maybe a starting point as a guess. 300 milligrams of benfotiamine, 400 milligrams of CoQ10, and about 1.5 grams or 1,500 milligrams of alpha-lipoic acid would be kind of a good starting place in that regard. Now, if you've been struggling for years, are you sure it's Lyme nerve leg pain? Not Lyme nerve leg pain, and not some other type of nerve leg pain. I see this a lot where people are told something that's plausible, and it sounds very logical, but it actually ends up being not accurate. This is where testing becomes, in my opinion, very important. Getting the right nutritional testing, because a lot of things can cause chronic neuropathy beyond Lyme. And sometimes because Lyme can affect the GI tract, it causes malabsorption, and that malabsorption leads to nutritional deficiencies. And it's actually the nutritional deficiencies causing the neuropathy, not the Lyme. It's an indirect causation, right? So I don't know what you've had done, but anyway, hopefully that's helpful in terms of the context of the question. Type 2 diabetic and cardiac ICU for heart attack and weak heart. She had a brain clot removed this week, and doctor wants to start drug to strengthen the heart. Drugs don't strengthen the heart. There's no such thing as a drug that strengthens the heart. I mean, drugs don't fix that. Drugs don't strengthen the heart. I mean, the statement itself is the answer. I mean, I can't give you medical advice here. I know it's a tough situation, but if my grandmother were in the cardiac ICU and they wanted to pump her with a drug to strengthen her heart, and that's what they were telling me, I would ask them to give me the research that shows that drug actually causes a physical improvement in cardiac output or strengthening of the heart. As far as, she got in that ICU with that heart attack, there was a reason that happened. And most likely it has to do with her choices and her behaviors around her diet and her lifestyle. So, I mean, those things have to be a priority. Now, post heart attack, there are sometimes some medical interventions that aren't a bad idea in the short term to prevent the risk of another problem or another heart attack from happening in the immediate. And that may be, what those doctors are recommending. I don't know. I wasn't part of that conversation, so I can't. Sometimes what somebody hears and it's secondhand information, and then that question gets asked to me, and it's like, that's not what the doctor meant. That's not what the doctor was saying. And so I don't want to give you, an answer out of context. But drugs don't strengthen the heart. A lot of the drugs that they're going to give in that situation, if I'm speculating here, they're going to be wanting to give blood thinners like aspirin or warfarin or other blood thinning meds. They may want to be giving some things to affect the heart, like beta blockers, etc. But they're not going to really strengthen the heart. The blood viscosity problems are mainly responsible for creating heart attacks. I mean, there's a lot of nutrition wrapped around in that conversation where, as an example, sometimes heart attacks are caused by vasoconstriction of blood vessels that feed the heart. And that's not a clot. That's not a plaque. That's a vasoconstriction. And that can be caused by amino acid deficiencies like citrulline and arginine that are necessary to make nitric oxide that keep the blood vessels that feed the heart dilated. Vitamin C deficiency could contribute to that in a sense. And vitamin B3 deficiency could contribute to that. So does she have those things? Hard to say. Getting her tested would be, in my opinion, the best move you could make. But, she's got to be the one willing to do all those things. I have found a lot of people who have family members that love them, and their family member that loves them want them to do something, but that person is very conventional in their thinking. And if that person is conventional in their thinking, it doesn't matter what you tell them. It doesn't matter what you say to them. They're going to make the decision that they're the most comfortable with making. And sometimes we have to live with other people's decisions, whether we agree with them or not. And that's a tough place to be. Your opinion on the binder cholestyramine as a potent binder? I'm not a fan of it. I know a lot of doctors like to use it. There are other binders. I mean, charcoal and zeolite are great binders. Pectin can be a good binder. Other fibers can be good binders. But cholestyramine is a synthetic binder that blocks the absorption of fat. So if I'm trying to help somebody, first do no harm. I don't want to use a binder that causes vitamin A, D, E, and K and omega-3 fatty acid deficiency. And in light of the fact that cholestyramine is used as a binder for mold toxins, which is, what it's predominantly been being touted for, I need that person's omega-3 to be top notch, because if they've got SIRS or chronic inflammatory response, and I'm giving them a high doses of a binder that blocks their absorption of omega-3, then I'm setting them up for dysregulation of inflammation. And that to me just doesn't make good sense. On top of that, it blocks cholesterol and or reduces cholesterol. And when we're trying to recover from chronic inflammation, we need cholesterol. Cholesterol is a healing molecule. We need it. Our brain needs it. If you've been in mold and your brain's deteriorated and atrophied, you need cholesterol to rebuild those synapses. If you don't have it and you're taking high doses of a binder that blocks it, again, just first do no harm. It's just, there are other better options, in my opinion. What do you recommend for better circulation overall? Lots of things. Depends. Just a short list of things that I put it a priority. Number one would be omega-3, 2 to 8 grams a day, depending on the person. because it's an essential fat that regulates blood viscosity. Number two, I would look at magnesium very seriously. Many people are deficient in magnesium, and magnesium naturally inhibits platelet aggregation, so it naturally keeps the blood from being over clotted, so to speak. But those two would be at the very, very top of the list of things that I would look at for improving and better blood flow. There are other things as well. Certainly, you can look at. Well, for example, you could look at white willow. And I'm talking about herbals now. Ginkgo biloba can help increase the blood flow. Proteolytic enzymes, like bromelain and nattokinase. These are all examples of things that, we know the research in humans have shown improvement in blood viscosity and blood flow. So lots of great options depending on the person, depending on what's going on. Better circulation as well. Let's not forget, despite the oral, what you can take, exercise, sunshine are probably the two most effective ways to improve circulation, above and beyond medicine and above and beyond any supplement you could take. And it's the two things that people run away from the most, exercise and sunshine. Thoughts on nicotine patches for health? They're not necessary for health. I mean, there's certainly a drug effect of nicotine that can be helpful for people who are struggling, but should a healthy person use nicotine patches to maintain good health? No, it's not. It's not true really of any medication or any drug. But there's a ton of people out there selling those patches. It's kind of like methylene blue. There's a ton of people out there that'll sell you methylene blue. The people that are looking for drug solutions to their health, in my opinion, are barking up the wrong tree. You're not going to find real answers in passive modalities that are drug-based without paying a consequence. And there's two consequences you're going to pay. You're going to pay the side effect of the medication, but you're also going to pay the side effect of the lost time and accumulation of damage over that time, because you're not looking for the real answer. You're just trying to feel better with passive modality. Does a bone marrow supplement and collagen help with pain? A collagen and bone marrow supplement might help in the sense that you're providing a base nutrient to help your body heal and repair, damage. And if your pain is caused by damage to that tissue, then yes, they could be supportive in that recovery, but they're not going to have pain reduction effects, so to speak. I think I just answered the question about methylene blue. I'm not, you're not going to achieve great health with something like that. People that, so we just have been fighting a battle for 50 years to get dyes out of food, and now all of a sudden we're wanting to use dyes to improve health. It's really kind of the world we live in is kind of crazy that way. Let's see here. How to heal and repair a meniscus tear? Well, it tore, probably over a traumatic reason. So, there are lots of things that can be done from a trauma. So trauma is different than self-neglect. So like you could have knee problems as a result of like sedentary behavior, chronic sitting, what I would call self-neglect. And then you can just have damage to the meniscus. And there are a number of different things, but I would look at physical therapy mixed with good chiropractic care, lasers, possibly BP 157 as a means to help improve or help heal a meniscus to minimize the risk for, the potential need for surgery. Who can supplement with vitamin A? Pretty much anybody can supplement with vitamin A, but you have to be careful of all the vitamins. That's one that taking at super high doses for really long periods of time unmonitored can contribute to the potential for liver problems. So, I'd be careful around it. Can omega-3s lower blood pressure? Yes, they can. How about heart rate? Yes, they can. What impact do they have on blood vessels? They improve the elasticity of the lining So omega-3 is where it's at. You should watch my show, Melinda, on omega-3. I did a crash course on that a while back. Do you have a video on shingles? What are some good options? Best option for that would be high doses of lysine and high doses of vitamin C, Melissa. We're talking, 2 to 4 grams of lysine supplementally on top of what you would get with your diet. And then, 5+ grams of vitamin C would be good options, as a high dose kind of trying to kick it. We also have a product called Virid, which mixes several things that have kind of viral supportive properties that we also frequently recommend when people have that issue. VIRID is how you spell that. It's available at Gluten Free Society. Do rice flour and supplements affect the joints also? Yeah, I mean, get the rice out. Rice is garbage. It's, aside from being contaminated with cadmium and arsenic, if you're gluten sensitive, it's a bad idea. What causes cherry angiomas? Can they be reversed? Typically, estrogen dominance is a major driver of cherry angioma formation. Now, estrogen dominance is not because usually women or men are making too much estrogen. It's typically because they're being exposed to environmental estrogen. So plastics like BPA and other BP, bisphenols, cosmetics contain estrogen-based chemicals. You also have pesticides and herbicides that mimic estrogen. There's a mold toxin called Zea that mimics estrogen. So most people with cherry angiomas are being exposed to chemicals that mimic estrogen, endocrine disrupting chemicals, or in mold. Those are very common. And I've seen cherry angiomas improve and not in all cases go away, but in some cases where they start to diminish and go away, when you figure that part out and you kind of help flush those receptors of that synthetic chemical estrogen, flush your hormone receptors, and that there's strategies around that. One of my favorite things to do to help with that, we have a product called Ultra Liver Detox, which can help with kind of flushing those things out. But you can check that out and read more about it. View on ozone therapy. I think it can be very effective and very helpful depending on the person. So I had a case this week of severe RA pain who tremendously benefited from prolozone and ozone therapy injections and ozonation of the blood. So it depends on the context of what it's being used for, but I've seen it do really well in that regard. Let's see here. I bought an incandescent bulb and fixture from Petco. I had a bad toothache, almost in tears. I opened my mouth, shine light, pain gone in 10 minutes. I believe in red light, but not LED bulbs. Yeah, red light is powerful. That's why sunshine is so important. It's the freest red light in the world. Go outside. B vitamins are sufficient to help to take 2B completes daily for nerve pain. Due to pinched nerves, is there a concern to take willow bark while on Tirosint? No, but take them separately from one another, and that's the way you should take Tirosint, is on an empty stomach, Tammy. But will B vitamins help with a compressed nerve? It might help with the repair as you're getting treatment for the nerve, but you've got to get the nerve unpinched. So if there's a physical pressure against the nerve, that physical pressure does have to be dealt with. Let's see here. Go down a little bit for me. I get sun 30 minutes a day. Should I use sun oil? No. I mean, if you're talking about sunscreen, no. The whole premise of sun is to go get it, not to block the UV or the benefits of the rays of the sun. So, if you're talking about sun oil, like just a tanning oil, to each his own on that. I'd say look at the ingredients and make sure it doesn't contain a bunch of nonsense. And then, if you want to use it, it's up to you. Scroll down a little bit more. Keep going, a little more. I'm fasting now and I feel really great. Is fasting good for autoimmune disease? It's good. It is good for autoimmunity if you can tolerate it, and it sounds like you can. The problem with fasting and autoimmunity is, so what fasting indicates is that you have food reactions, is you're taking food away and your body's feeling better. But at some point you have to eat, and you have to provide vitamins, minerals, calories so that your body can heal and repair the damage. And so this is the conundrum with fasting, is that you can't just fast and overcome autoimmunity, because ultimately you'll become malnourished. So intermittent fasting is a good strategy if you tolerate it well. But keep in mind, fasting, people who benefit tremendously from fasting and feel better and feel less pain, etc., it's because you're reacting to a food. So it's very important that you get tested for food reactivity and remove those foods. That way you can pick the foods that you're not reacting to, and still get nourished. Okay, let's go back up to the. Does it hurt to take essential amino acids in powder form for post-op long-term surgical joint pain? Not at all. It doesn't hurt at all. It's very beneficial, as a matter of fact. Is grain-free and dairy-free sufficient to fix an autoimmune disease, or should everyone also quit lectins? It depends on the person. I mean, if you read my book, we talked about it earlier in the show, blueberries was a culprit in Ginger's case with, the little girl that was terminal. She had 6 months and she was blueberry allergic, and every morning got a blueberry smoothie for breakfast. So, in her case, grain-free, dairy-free wasn't enough. She had to be blueberry-free as well. But one man's food is another man's poison. So, but grain-free, dairy-free is a great place to start. But if you're plateauing on that, you've got to start looking at what other triggers that you might have that could be contributory. Best vitamin for the eyes? I mean, best vitamin A, hands down. It's very important, but you need zinc as a mineral to carry the vitamin A. Zinc makes something called retinol binding protein that binds to vitamin A and carries it and distributes it into the eye. So you don't absorb vitamin A very well into the eye without zinc as a carrier. But as far as like a targeted regimen for the eye loves antioxidants. It needs a lot of antioxidants, especially some of the carotenoids and other like really rich, vibrant colored that you get from eating plant-based foods. We have a formula called Focus that contains an array of different nutrients that are eye important, including vitamin A and taurine and zinc and others. Neuropathy, pain, burning legs all the time, already did the diet. No sugar, no grains, no seed oils, even painkillers don't really touch the burning. Vitamins or supplements and dose. I think I answered that earlier. That was a repeat question. I find that most of the time I have a headache, a big glass of water gets rid of it. Yeah, dehydration is a simple solution, water. When doing the nutritional lab test, is there anything you should do to get accurate results when you take a lot of supplements? No. The test is measuring intracellular quantities, so it's not impacted, by your day-to-day. It's impacted, so we get a 6-month average over time when we do, lymphocyte response testing like this. So you don't have to worry about that part, but getting tested will give you a better idea about how to adjust your supplements down the line, and you might need different ones, you might need less, you might need more, depending. I hear ice pick headache is rare and is a condition. I don't know what you mean there. The headache question made me think of this. Do you know anything about this? So ice pick headache is usually a neurological headache. It's usually a form of migraine. Ice pick is just a descriptive term, but I don't know what your question is. I didn't gather or garner a specific question from that. Can you recommend a natural alternative to antibiotics? Probiotics, Bruce. Probiotics are great. Now, if you've got an acute life-threatening infection, take the antibiotic. But if a lot of times people don't give their body an opportunity to heal and repair itself, and they just run straight to the doctor, and then all of a sudden now you're on an antibiotic that may or may not be necessary. It's estimated that more than half the antibiotic prescriptions given out in the U.S. aren't necessary. They're just in case type of antibiotics. But probiotics are a great alternative. Depending on what you're talking about, there's a lot of herbs that have antibiotic properties. I personally like uva ursi, grapefruit seed extract, berberine, oregano, thymol, which is from thyme, all olive leaf extract, all have really great, plant medicinal effects that can be helpful. Anything for tennis elbow? You got to go back to, do you play tennis? Or did you just get the diagnosis because you have some kind of repetitive motion that it flares that inner elbow? Rest, ice, infrared, if we're talking about passive, infrared therapy, SPMs, massage, especially you can do, you don't have to pay a massage therapist per se, but you could do a massage gun, like they make, different massage guns that can get in there on that tendon, and can really push blood flow and nutrients into that area, because it's, again, when you have a tendinopathy, a tendonitis, they're not super vascular. So you got to get fluid going into that area to help it heal. So all those things could be helpful. How to lower homocysteine: folate, B12, B6, B2, methionine, and choline and trimethylglycine are all nutrients that regulate homocysteine. Can creatine be beneficial for people who don't work out as much? Yes. There's studies now showing improvements in mental performance, improvements in energy, reduction in pain. Creatine is beneficial for a lot of things. Attached floaters in the eyes. If you've got floaters, your blood sugar's too high. The vitreous humor, the fluid in the eye, you'll get misfolded proteins and accumulation of debris that manifest as floaters, and you've got to control blood sugar. So nutrient testing, it could be chromium, it could be vanadium. Maybe you're exercising really well and eating really well, but magnesium, chromium, vanadium, zinc deficiencies all create blood sugar problems. Have you watched my crash course on blood sugar? That might be a place to start as well. Does climate have a factor in your health? Can, depending on the person. I've had a couple cases over the years of people who in Houston had major mold problems, and they would make trips to the mountains of Colorado, and feel so much better when they were there. And they both ended up moving as part of their life plan solution, and they found that they just did better in that type of environment. But yeah, so environment can definitely affect a person's health depending on the person. Like myself personally, I love the heat. I'm like a lizard. I want to lay out on a rock and just soak up the sun. And when the heavy winters come through, I don't really care for the cold at all. It just, it's abysmal to me as a person. So, it definitely affects my quality of life if it's happening, but it's unique to the person, and sometimes unique to what the person's being exposed to in the environment that might not be good for them. What supplements do you recommend for low hormones? Well, I recommend getting tested for nutrition first, because nutrition is where hormones are produced. So hormones are made out of nutrients. And so how do you make estrogen? Well, what do you need? You need folate, you need B6, you need vitamin B2, you need zinc, you need magnesium. And so if you don't have those nutrients, and you're not going to make estrogen effectively or efficiently. So you want the nutrients first. If the nutrients are present and there, and you don't have deficits, now you can start looking at, okay, is hormone replacement therapy a better option? Or even beyond that, are you doing something that's driving, low hormone levels? Have you had a surgery like a hysterectomy? And there's a lot of variable factors in that. Can someone have gut permeability issues without noticeable or physical symptoms? Yes, they can. It's possible. Generally, a leaky gut isn't what causes immediate symptoms. It's a leaky gut chronically over time that starts to manifest into a process called molecular mimicry that can start to trigger autoimmune responses. So definitely you can have it without symptoms, but that's not to scare you guys. I don't think everybody that is asymptomatic needs to run out and try to figure out whether they have permeability. If you're feeling great and making great choices, keep doing that. Have you ever heard of retinal migraines? Yes. Strange things happen to your eyes, last 20 minutes, then headaches for 2-3 hours. Ever heard of it? Yeah, you got to go grain-free. You got to get the triggers out of your diet. Denise, we have a really good video on migraine triggers that you might want to check out, including retinal migraines. And also look at your environment for mold, because that's a real super common factor with retinal migraines. Let's see here. What did my family use to heal from mold? Simple. We used, number one, we got out of the mold. That was the first thing. That was the first thing we did. We didn't supplement our way out of mold. We got out of the mold. That's the most important step, Amy. Number two, binders. We used fulvic acid. We used carbon, granular activated carbon. We used zeolite as well, alpha-lipoic acid. We used N-acetylcysteine and glutathione and B vitamins, and we tested. I mean, we honestly did nutritional testing to determine unique needs so that we could support our bodies in a unique way, right? What our body needed is what we wanted to give it. So the testing helped us to determine where we might be lacking nutrient-wise so that our bodies could recover more quickly. A lot of sunshine to recover from mold, and a lot of sunshine, combine that with fresh air, right? You're outside a lot when you're recovering from mold, or you should be, ideally, right? Depending on where you live and what time of the year it is. Also, exercise. Once you're out of the mold and and this is to tolerance, because a lot of people in mold are super tired and fatigued, and exercise just knocks their socks off. So for us, it was, what can you do? If it's just stretching, then that's what you do. If it's just mobilization and movement, if it's just lifting your body, that's all fine, but doing something consistently, because it's pumping your lymphatic fluid, right? You trying to get this stuff out of you, and your detoxification through your lymph has no heart to pump it. So your muscles are the lymphatic pump of the body. So moving becomes a very important aspect around detoxification. Maintaining good bowel flow, as you have the bowels release or push mycotoxins out. So if you're constipated, that's going to pose a problem for enterohepatic recirculation of mycotoxins. So you want to make sure that you're not constipated. For us, vitamin C at higher doses prevents constipation from happening and keeps the bowels moving consistently. You want to sweat a lot. If you've got an infrared, great. I like to go outside and sweat. I live in Texas, so that's real easy. But a lot of sweat, because mold toxins come out through your sweat, they come out through your pee, they come out through your poop. So you want those three channels engaged, right? So lots of liquids and fluids to hydrate and to urinate, keeping your bowels flowing, and lots of sweating. But those are the fundamentals. If you're on blood thinners, okay, no, not a question. John, oh no, commentary. Daughter's surgery yesterday. Where'd it go? There it is. All teeth pulled and jaw shaved while awake, type 1 diabetic. Felt all the pain. Oh, I'm so sorry that she had to go through that. The face is swollen, blurred vision, lots of thick mucus. Oh man, why did she have all her teeth pulled? There's a whole story there, I know. Have you checked, Betsy, have you checked out my post-surgical protocol? I mean, hands down, I would have her on glutamine. I'd have her on branched chain amino acids. I'd have her on vitamin C. I'd have her on minerals. I'd have her on a really solid multivitamin. But I check out my post-surgical protocol. If you go to Gluten Free Society, just type in surgery protocol, and that article will come up. And there's a whole protocol that we recommend people do post-surgery to engage recovery and reduce pain medication needs and other things. So that's probably the best place to start. If someone's suffering from tendonitis, tendinosis of both shoulders, elbows, and sit bones, plus knee pain due to cartilage, BPC 157 or PRP, yeah, I mean, those are both potential options. Prolotherapy is another option. Supplements, I would do glucosamine chondroitin. I get tested. If you've got that much tendonitis in that many different areas, there's something else going on there, Harvey. I mean, you don't just develop bilateral tendonitis in that many areas unless you have a systemic inflammation driving it. So you have to figure out what's driving the systemic inflammation. Food, chemicals, microbes, nutritional deficiencies need to be investigated in order to get to the bottom of it. The BPC and the PRP can be helpful, but they're not going to stop the ongoing inflammation if it's something that you're doing causing it. Is all lecithin and xanthan gum a no-no for someone diagnosed with leaky gut? No, not necessarily. Lecithin, it depends on what it's derived from. A lot of lecithin is soy derivative, GMO, which I would say, yeah, you don't want GMO soy lecithin, but there are other lecithin options that are not necessarily problematic. I wouldn't put them all as a no-no, but if you've got major leaky gut and illness, where do you find things like lecithin and xanthan gum in processed foods, right? Because they're used as thickening agents or gelling agents, and so you shouldn't be eating those things because they're not going to help you recover. The number one factor around food for recovery is you can't get healthy eating food that's not. And those processed additives, although some people can get away with it when they are healthy, they're just not something I would encourage anyone to have exposure to on a regular basis as part of the staple foods in their diet. Are pulse electromagnetic devices good for pain? They can be, but what works just as well, Nancy, without having to spend thousands of dollars is to go outside and sit in the grass. You get all the EMF you need right there. I know a lot of people want to use PEMF devices, and I'm not opposed to them clinically. We've used them on people, but I've found over the years that consistent behavior of grounding outside is just as effective over the long haul. What's your opinion on the water ozone generators? Not a fan of ozone on the food. Ozone's going to oxidize your food more quickly. I'm not a fan of ozone room generators either because they deteriorate the building materials of your home. That heavy ozone will break down silicone caulking around your windows and around your doors and frames. So running high levels of ozone on a regular basis in your house as a mold preventative is a bad idea. If you want something for mold preventative in your house, look into hydroxyl ion generators is a better alternative. OH negative generators don't decay the materials that your house is made of. What do you recommend for hemorrhoids? Figure out what you're eating that's driving them, because that's typically the case, but witch hazel works pretty well. I'm highly sensitive to mold. Why does mold in the shower drainage trigger my symptoms? Well, if you've been hypersensitized to it, Sheila, then that's not an untypical side effect. Are you still in it? A lot of times you have to get out of the mold long enough to calm the immune system down so that you're no longer hypersensitized. That way, when you get some, minimal minor exposure here and there, it's not much of an issue. Alternative to chemo, mom is having chest and back pain from the tumor. Yeah, I'd go see again. I mentioned Dr. Makis earlier. I'd look into him and the work that he's doing with some drugs that are relatively over the counter, depending on what country you live in. He's doing fantastic work on cancer. Cold, pale legs below the knees, always cold, no diagnosis. Are you sedentary? Do you have good blood flow? Do you sit a lot? I mean, one of the best things for cold legs, lower extremities is, is movement. Put a treadmill if you work at a desk, put a treadmill under your desk and move. Circulation, increase that circulation. You might have some vascular issues that you want to get looked at. If you've got poor blood flow or potential for, for thrombus in your legs. So you might want to get those checked out just to make sure it's not that. If you haven't changed your diet, change your diet, because a lot of times people's blood viscosity increases and their circulation reduces or worsens as a result of eating inflammatory foods or being exposed to inflammatory chemicals. Child ear infection and pain. It's a tough one, depending on if he's already been on antibiotic and the infection didn't go away, or if the infection came back. From a natural perspective, high doses of probiotics. You might consider peroxide or silver, specifically hydrosolized. But I'd keep an eye on that, because you don't want that to get out of control. It's a tough one. How healthy is your child's immune system if he's getting recurrent immune ear infections? Is he in the water a lot? Because sometimes being in the water a lot can contribute to that. So maybe a lot to unpack there that's hard to answer, in this context. Let's see here. Is teff flour okay? No, it's not. How to tackle selenium deficiency? 200 to 400 micrograms of selenium a day for several months. You can eat Brazil nuts as well as a great food-based source of selenium. Have you heard of EM with Sears patients? I cleared mold and have Lyme. Define EM. There's too many acronyms. What do you mean by EM? Are you referring to like electromagnetic sensitivity? To help me understand, Laura, and I can maybe give you a better answer. Mold cannot grow on lime plaster. Yes, it can. Mold absolutely can grow on lime plaster. There's no such thing as a mold proof material. Now, it can grow a lot easier on a paper backing of sheetrock, but it absolutely can grow on lime plaster. I've seen it. If you're looking at building a new house, lime plaster would probably be a better option if you can afford, paying somebody to do that kind of plaster work. It's extremely expensive. Does gluten sensitivity cause fascia pain? It can, absolutely. Fascial pain is a very common manifestation of gluten sensitivity. Rib cage back, you name the area, it's an equal opportunity fascial blaster. Constant pale and cold legs below. I think I answered that question. Yeah, I would not. Yeah, so there's some commentary about. I think Rick is just chiming in. I wouldn't use hemcrete, Rick. I don't know what your experience has been with it, but we've actually looked into that, and mold grows on it. So it's not something that I would look. Concrete isn't. There's not a mold-proof material. I think the best way, like, try to build your house with better materials that are less toxic, certainly, but the better way to really dive in to to preventing mold is to control moisture. I mean, that's where it's at. I mean, if you can control the moisture, you can control the mold regardless of the material that your house is made out of. And that relative humidity in the home needs to be, below 55% on a real consistent basis. With the way homes are produced today, it's definitely a must. But I think if you can look, we've tested all kinds of mold resistant materials, and we've made them wet, and we've let them be exposed to the elements. And what do we find? That they still grow mold on them. They're not mold proof. There is no such thing as a mold proof material. Mold is probably one of the most dynamic life forms on the planet, and its job is to decay everything back to the earth. So you're not going to stop it unless you control the humidity. So if you're looking at building, look into the sciences and the technology around building humidity control. Is there a shower filter that you recommend, or pitcher filter for drinking water? I mean, the shower filters, you can find them. They have carbon KDF shower filters. They're a dime a dozen. You can pretty much get those at a local hardware store, and they work great. As far as a pitcher filter, don't really recommend a pitcher filter. Most of those have a cheap carbon in them, and they're not really going to be effective. Now, Berkey's a pretty good filter for the countertop, but it doesn't remove fluoride very well. So there are better filters. Reverse osmosis filters, if you live in the city, are going to be probably one of the more effective types of filters to use, and you can buy countertop units. We have somewhere, I think, on our website a link to a company that sells those. Had some water leakage in the bath, hardwood floor over time. Are there any ways to test for mold in the air on furniture? I mean, there's lots of ways to do tests. If you suspect mold on the wood, I might consider lifting a floorboard up and then swiping that floorboard with either a tape lift sample, most likely a tape lift sample, or even a swab sample where they can do a microscopic analysis. That would be one way to do an analysis. I wouldn't rely on an air test because they're just so inaccurate. Air tests, probably some of the most inaccurate way to get evidence of mold. And that was really well documented and proven after Katrina, when they were doing air testing on a lot of the places. They just couldn't get consistent data. And even the WHO, the World Health Organization, I think they recommend 27 air samples of an area to assess the air properly. And most companies that do mold air testing come out and they do one outside control and maybe one inside the room, which again, it's just to me, it's false advertising and very misleading. But I know in Texas, I think it's just a weekend class. To become a mold inspector, you need it's a very short class. So you don't have great expertise by taking the state class to get your license. That requires a desire for knowledge and experience and working with mentors, etc. Oh, burning hands and feet. So if you've got burning hands and feet, that's a burning neuropathy. That's a classic, oftentimes vitamin B5, Laura, is something that can cause burning neuropathy. In some cases, what we call pathognomonic, meaning if somebody's neuropathy is a burning neuropathy, then B5 would be the first choice if we're guessing. So if you haven't tried high doses of B5, 500 to 1,000 milligrams a day, you might just look into that and read more about it. What is there exactly? There is paint available for the walls that are moisture proof. Oh, not a comment. That's a comment. Is there anything that I could take to help with symptoms that I get from mold while I wait to see a holistic doctor? Long walks outside out of the mold that you're living in, Sheila. Get you a lawn chair under a shady tree and just sit down outside as much as you can. There's not anything, I mean, you can do binders, we have a product called MycoBinder, but, and you might get some reprieve, but probably not. Vitamin C, might give you some reprieve, but it's going to be very, very limited. As long as you're still being exposed, it's really, really tough So as much time outside as possible. Let's see, drywall, let's see. Yeah, go up just a little bit. I think I missed a couple there. How much MCT to use in a day? If you're talking about why would you take, I mean, give me context around it. I mean, you can take a tablespoon, if you're talking about an MCT liquid, 1 teaspoon up to a couple a day is real safe. I mean, but what are you wanting to use it for? A little higher. Is colloidal oatmeal in creams or baths okay for eczema? I think I answered that one earlier. It's not something I recommend if you're gluten sensitive, for sure. A little higher. Yeah, just there's a commentary here. Okay, so Lynn says, I've had great experience with cholestyramine, but it's compounded and in low doses. Thanks for sharing that. I know we talked about that earlier. So low doses, just ask your doctor to check your fat soluble vitamins as long as you're on it. Check them every 6 months. I don't know how long you've been on it or how long you're gonna be, but I highly recommend that. Okay, I think we covered most of your questions today. Most of the ones, if I missed you, I apologize. There were so many in the feed. I was trying to go through the ones that were questions versus comments. But look, thanks for tuning in today to Pick Dr. Osborne's Brain. Appreciate your viewership. Do me a favor, if you want to support us, hit the like button below and make sure you hit that subscribe if you're getting value. Also, share this with somebody you know might be benefited from it. Together, we can reach more people. Our mission here is to save 100 million lives, and I can't do that without you guys sharing the love with others. So we appreciate that. Also, this week, if you're looking for pain relief and you're looking for supplements that might support that, we do have a coupon code if you want to use our products. What is that code? Do we know?
Natural 15.
Natural 15. So if you go hit that promo code Natural 15, if you watch Tuesday's show and you're looking for SPMs or white willow or glucosamine chondroitin or fish oil or any of the other things that I discussed on pain, you can take advantage of that sale this weekend and also support our mission at the same time. We don't allow advertisers, so we appreciate all of your support when you shop Dr. Osborne and Gluten-Free Society. That helps us keep the lights on, so we appreciate it. Thanks so much for tuning in. We'll be back next Tuesday for another crash course and the following Thursday for another live Q&A. Hope you have a great weekend. We'll see you then. Take care.